Well, it's a very important activity because antimicrobial resistance is a very big threat, public health threat. In fact, it's like a tsunami waiting to happen. Because what it means is irrational use of antibiotic now means that some pathogens, many pathogens that could have responded to the simple antibiotics we have in our hospitals will now become resistant, and you now need to look for higher antibiotics that could be more expensive and may not even be affordable. And the way it is currently, the resistance is even spreading to all those antibiotics that used to work before, that are readily available, that we were using to treat infectious diseases in our hospitals before now. So it is a global health problem, and in Nigeria it is a big problem because for now we do not even know the actual extent, the actual burden of antimicrobial resistance in our country. So what we're doing is to improve our surveillance systems so that we're able to detect antimicrobial resistance as they come. We are doing more of susceptibility testing, and we're building the capacity of our health facilities like the tertiary health institutions, secondary health institutions, to be able to detect antimicrobial resistance, and to encourage also what we call antimicrobial stewardship, where doctors, clinicians, and those who prescribe antibiotics now do it more responsibly. So we're also increasing awareness. For this particular antimicrobial resistance week, where it's titled Spread Awareness, Not Resistance. So we want to sensitize Nigerians to the threat of antimicrobial resistance in our country, and to also let people know that they can contribute towards limiting the spread of AMR, that's antimicrobial resistance in the country, by responsibly using antibiotics. You don't use antibiotics except it is prescribed by a clinician. And you have a right as a Nigerian to request for tests before you are prescribed antibiotics. What we have seen before now is that once somebody has fever or whatever, they mix a concoction of anti-malaria antibiotics and they give to the person without doing a test to know what exactly is causing the infection. And if it is not the right pathogen that you're treating, then the real pathogen will now develop resistance to that particular antibiotic. And this is not a problem only with human health. We also have it with animal health and even in the environment. People are disposing of antibiotics anyhow, and it is polluting the environment and causing more resistance, because even in the food items that you eat, you have small levels of antibiotics that will not be able to destroy the pathogen. So the pathogen now, that is the bacteria or the virus or the fungus, now develops resistance to the real antibiotics. And when there is a life-threatening situation and you administer that drug, the person does not respond to it. So it is a very huge problem. Also, not adhering to infection prevention and control measures in health facilities and in the communities is also increasing the risk of antimicrobial resistance, because what it means is that more people get sick, they have access to antibiotics, and many people don't even complete the treatment. When they are prescribed for 5 days, you take 2 days, 3 days, the fever is gone, you think you're okay, you stop. Meanwhile, the bacteria is still there, or the fungus, or the virus is still there. So when the time now comes, the virus, the pathogen will now develop a thick skin, more like a a covering that resists, and features that will resist that particular antibiotic when the need arises. So this is a call to all Nigerians to be aware and to become stewards themselves. Spread the news, spread the awareness, don't spread the resistance.